As the use of AI grows in popularity, many people are turning to technology instead of a professional for advice on mental health.
I don't know. Seems like a bad idea to me. But AI is, it's not quite equipped to provide solutions that you're looking for. And that's why we are turning to an expert here who's going to give us a little bit of help from a professional standpoint. Dr. Sarah Getch from Kansas City University is here. And Dr. Getch, always great to see you here. And excuse me, I was just talking to Crystal. The proliferation of AI in our lives is it's happening so fast, and we're seeing it on our social media channels, seeing it on television, seeing it in a lot of places. What's your initial impression about this advanced technology?
Well, I know we sort of feel surprised by it, this wave of AI, but it's been a growing trend for a long time, right? So people have really sought out these self-activated tools for psychological help, mental health, medication management, all of those things. It's been growing for some time. But now we see them using it a little bit differently for social connection, emotional support, and that can be sometimes pretty concerning.
Yeah, and I'm sure accessibility, right, to mental health can also impact someone's decision on whether they can seek a professional or should I just go online, you know, it's free, I can get advice that way. But will AI actually know when somebody needs more professional care or like at that time intervening?
Right, I mean, you nailed it. So sometimes people feel like they don't have a safe person to turn to. And so that's why AI can be so appealing. You know, it's immediate, it's non-judgmental, and it seems like it's understanding. But to your point, it's not really understanding. AI isn't smart like you know. AI is interpreting text, but it is not comprehending. And right now, it's dangerous in the sense that AI cannot sense a crisis, a psychological crisis. It's not picking up on when individuals are suicidal, have suicidal thoughts. That can be problematic too. And unfortunately, there have been instances where it's reinforcing some of those suicidal thoughts rather than encouraging folks to get help.
Yeah, and that's why, you know, and that's why talking with someone is so important. Talk to us about some of the other resources that are out there for people who, because, I mean, some resources are pretty limited in terms of the healthcare, in terms of mental health field. Where can other people turn to?
So I think the best thing to do is to, well, one really easy way is to go to your primary care provider and say, I'd really like to talk to somebody. Do you have any referrals? Because they will have a list of referrals to be able to access psychologists and counselors. And I want people to think about AI as a supplement, as a tool to that work, to working with a psychological professional who understands emotion, who actually understands you, understands context in which you're talking in, you know, your behaviors and thoughts exist in context, and AI doesn't pick up on that. So always go to your PCP and say, you know, do you have any referrals? And then your insurance company, too, can give you a lot of good referrals.
I'm curious. You research all these types of things, and you know all of this kind of stuff. What are you using AI for, and how has it helped your profession?
So thank you so much for asking that question, because we recently designed a course for my students at KCU, Kansas City University, where it's called Tech and Psych. And so we are training our clinical psychologists to know what's a good app, what's a bad app, where does your data go, what do they do with your data, how can you use this as a supplement in therapy, how can you use it to help manage your behaviors outside of therapy. So we're actually training our students right now on those tools, and there are amazing psychological scientists who have developed great tools for people to use. But that's another job for a professional, like a licensed psychologist, to tell you, this is the tool that works for you. This is a tool that will work for you. It's safe. Your data is confidential. They're not going to sell it, that kind of stuff.
Yeah. Well, and with these new tools and resources, I mean, why else is it just so valuable to talk to a professional and have someone, you know, even just a human being?
Right. So part of what works in therapy is relationship building. That is one of the mechanisms that drives change, is being able to build a relationship with somebody, and you learn new skills, new tools in building social relationships. And you can't do that with AI. It just won't work.
Yeah, absolutely. Dr. Sarah Getch, Great to see you, as
Good
always.
to see you.
Yeah.
Thank you for having me.
Another great topic there. So come back and see us sooner than later, all right?
I will.
Thank you so
Oh, by
much.
the way, it's nice to meet Abe, too.
Oh, yeah. He's the best.
All right, well, Fox 4 does want to remind you that you matter. If you or a loved one is experiencing a mental health crisis, the National Suicide Prevention Lifeline is available 24 hours a day. You can call the number right there on your screen. We also have more resources on our website, fox4kc.com/youmatter. We'll be right back.